Welcome back. Tonight we're joined by Dr. Jona to educate us, the public, about critical HIV prevention tools, namely PrEP and PEP. As we continue to tackle the stigma around HIV and strive for a healthier, more informed society, it's crucial that we understand the options that are available to us. Whether you're someone who wants to protect yourself, a healthcare provider looking to guide patients, or just someone wanting to stay informed, then this conversation is for you. Dr. Jona, good evening and thank you so much for joining us.
Yes, good evening, Nina.
Thank
and good
you so
evening
much
to the viewers.
Well, let's get right into it. I don't know how many people are still unfamiliar with this topic, but there might be some. So for those who are unfamiliar, just briefly explain what PrEP is and how it works to prevent HIV.
Yes, so PrEP stands for pre-exposure prophylaxis, meaning that is the prophylaxis before, okay, exposure. So it's the use of antiretroviral drugs in specific combination to prevent possible infection by the HIV virus. Yeah.
All right.
So it's usually 2 drugs. We have tenofovir as well as emtricitabine. That's the common combination that we have here.
In Namibia?
In Namibia, yes, right. It is available. And yeah, it's a combined pill. It's one pill that it's taken once a day, the same time every day, yeah, for as long as there is the risk of HIV infection.
All right, we'll get into the nitty-gritties just now.
Yes.
Moving on to PEP. What is PEP? And of course, talk to us about the differences in terms of usage and timing, etc.
Yeah, so PEP, on the other hand, is post-exposure prophylaxis. So which means this is now prophylaxis after a possible HIV, like risk of HIV infection is there. So it's also use of ARV drugs, but in PEP, depending on the risk, we actually assess the risk. Low risk, we use like a double combination, and if it is a high risk exposure, we use a triple combination. And yeah, so basically it's a pill that is taken. It should be taken as soon as possible, as soon as a possible exposure has happened. So it's very important to document. Somebody will come in and I'll be asking, well, when did something happen? It's very important because PEP needs to be given within 72 hours.
After exposure?
Yes. And it's a pill that's taken once a day, every day, the same time for 28 days.
Okay.
Yeah.
I also want to ask, how effective are PrEP and PEP in preventing HIV?
So I would like to state that they're not 100% effective, but obviously with strict adherence, very, very important, it will obviously result in a high efficacy. So which means the effectiveness depends on factors like adherence, taking the drugs on time, and so on. So, yeah.
So, for example, you mentioned that PEP needs to be taken 72 hours after exposure.
Yes.
If those 3 days have lapsed and I come in at 96 hours, is it still effective? Would I still be able to receive assistance, medical assistance?
We highly discourage that, and because then the effectiveness will significantly drop, you know. So we encourage that people are well informed. Should they find themselves in, you know, a situation of a possible exposure, they should come to seek health advice or medical advice as soon as possible. So within 72 hours. After that, it becomes less effective, yeah.
With PrEP, Dr. Jona, explain to us in what circumstances somebody would decide to go on PrEP, or, you know, a healthcare practitioner would advise somebody to go on PrEP, because the conversation around it now is that if you suspect you may have an unfaithful partner, that's like the main reason, then you should go on PrEP. But Please talk to us about that.
Yes, so we advise individuals who are HIV negative.
Right.
Very, very important, because then there is no point in putting somebody on PrEP who could potentially be HIV infected already. So this individuals, we just put them straight on treatment. But those who are HIV negative, who are in serodiscordant relationships, meaning the one partner might be the one partner is positive and the other one is negative. So it's advisable for the partner who is negative to definitely get on PrEP. Also, very important for all the breastfeeding moms in this type of relationships, as well as pregnant mothers as well in serodiscordant relationships, as well as women in serodiscordant couples who are also trying to conceive. Let's say maybe this couple used condoms throughout, but they are now ready to
try for a baby.
Yeah, to try for a baby. So we usually put the one partner on the PrEP for that time, and then we stop it once they have conceived. Yeah.
All right. I want to know how accessible PrEP and PEP are in Namibia. You mentioned, of course, that the combination of medication that is used is available in the country, but what about the rural or the under-resourced areas? Do they have equal access to?
I must commend government through Ministry of Health. They have really done quite well. You'll actually be able to find PEP and PrEP at the furthest clinic ever in the country. So the ministry has definitely made sure that it is accessible, even at primary healthcare facilities.
Fantastic. So it's available at government facilities and, of course, private as well.
Yes, and as well as private healthcare facilities, of course.
There's still a lot of misunderstanding and I think stigma around the topic of PrEP and people who take PrEP. And what is it that you'd like to destigmatize about this topic this evening?
Yeah. So it's just to mention that in terms of PrEP and PEP, it's really an opportunity to prevent oneself from contracting this permanent infection for now, because they are doing research on a cure and so on, but at least our guidelines have not implemented that so far. So it is that opportunity, and should one find themselves in a situation where they have been potentially exposed, whether even in our profession, occupational exposure does exist, from needle pricks, nips and cuts during surgeries, or non-occupational exposure, like for rape victims as well. So it's go out there, seek for medical advice, and make sure that you protect yourself from contracting HIV. But I would like to mention that the most important thing is we should still go back to the ABCs, which is abstinence, consistent condom use, as well as being faithful to one partner. So it's not a free pass for reckless sexual behavior. Very, very important. Yes.
With PrEP, I also want to ask, just before I let you go, once you start, on the medication, how long do they need to take it for? And also, what are the long-term and short-term side effects of the drug?
Yes. So with PrEP, the individual has to take it for as long as the HIV risk is there. So, for example, we go back to the serodiscordant couples. As long as that risk is there, then the individual needs to continue taking PrEP. And what was your question again?
Side effects, long-term or short-term?
Okay, so the short-term side effects is things like transient, obviously. They are most of the time self-limiting, or they resolve on their own, but it's important to let the patients know that they might experience things like nausea, vomiting, headaches, and digestive problems, probably diarrheas and things like that. But they're really self-limiting as long as you have informed the patient not to stop the PrEP. If it is something overboard, they should come in instead of stopping the PrEP on their own. So long-term, obviously, before we start patients on PrEP as well as PEP, there's certain specific tests which are done. And obviously, a comprehensive medical assessment to see and to make sure that this individual will not have experienced drastic side effects, like maybe they have a pre-existing kidney failure or liver failure or things like that, that it doesn't become worse. So long-term effects, it's possible kidney failure and liver failure, but then these are quite rare.
Well, Dr. Jona, indeed, you've educated us this evening. Thank you so much for joining us here on the Daily Roundup.
Thank you so much, Nina. Thank you to the viewers.
When we come back, we've got one more conversation lined up for you. Don't go anywhere. We'll be right back.